Welcome to our introduction to the Mental Health Support Team. Throughout this presentation, we hope you learn more about our team, who we are, and the work we do in supporting children and young people, parents and carers, and a whole school approach to mental health and wellbeing. The Mental Health Support Team in Schools, or MHST for short, are an NHS service within Devon Partnership Trust and Children and Family Health Devon. MHST offers early intervention support to help children and young people with their mental health and emotional wellbeing. We work as part of the Child and Adolescents Mental Health Service, also known as CAMS, within the NHS. The MHST team work alongside the team of child wellbeing practitioners, also known as CWPs, who also offer early intervention support but work within the community and not directly in schools. However, MHST work directly in primary, secondary and specialist schools to provide this support. We ensure we work closely with schools in a collaborative way to promote a whole school approach towards mental health. We are an all year round service and continue to provide support throughout the school holidays. There are a variety of ways we offer support by working directly with children, young people and their families through therapeutic guided self-help as a form of early intervention. Throughout this presentation, we will cover what support we offer in more depth. Our team is made up of a clinical team manager who oversees the team. There are numerous supervisors who work closely with schools, supervise the qualified and trainee team members and carry out clinical work. The qualified and trainee education mental health practitioners carry out clinical work to support children and young people whilst promoting a whole school approach through workshops and sessions with school staff and parents and carers.
This 5-minute video gives some more information on our service. Please take some time to watch it and become more familiar with the kind of work we do.
The mental health support team in schools works across Devon, and we're in schools to support them in becoming more mentally healthy environments and to make sure that mental health in schools is taken seriously as a physical health condition. So we wouldn't expect someone to come to school with a broken leg and go through them day like normal, and we want mental health difficulties to be treated in the same way. The kind of things we do on the team to help children and young people is we deliver workshops on mental health that's giving information around different topics around mental health, so coping with anxiety, low mood, coping with exam stress. We provide support to staff within schools, we provide staff training and one-to-one support for staff who might be supporting students that are struggling with mental health, and we also provide one-to-one support for students that might be struggling with things like depression and anxiety.
My mum and dad noticed I was anxious at school.
Did anyone at school know how you were feeling? Friends?
I don't think so, to be honest.
Ryan was really struggling at school, so he would come home and be quite upset because the transition between going from primary school to secondary school was being quite difficult for him. He didn't find it very easy to talk to people.
Because school was becoming really difficult, so I thought that I could go and get some help from the MHS.
When he started working with his practitioner, he would come home and say, yay, I've seen my practitioner today, and sort of go through what's been going on. And so it was absolutely amazing. It's been really, really helpful. It's enabled him to talk through some of his worries and challenges and been able to put his thoughts into some sort of order that he can manage. And it's been something that we can actually do alongside as well, so as not to confuse him. We've been sort of doing the same things with him, so at least he gets that from the school, from us and from the team, so that we've got that sort of continuity of how we're supporting him and how he can actually have better control over his thoughts and his worries, and in a more positive way.
We work with the mental health support team through interventions mainly with our young people, so that is providing low intensity CBT through face-to-face interventions that go on weekly. We then also look to provide support for our staff through Time to Reflect, which is a supervision space, but also non-pupil evenings where staff are trained on what is mental health, what is anxiety, and making them feel more confident in their ability to manage those common mental health issues within school. We then also look to collaborate with the mental health support team around providing support for our parents and carers of our young people. So that's again looking in a similar way to staff, upskilling their knowledge and understanding, but also bringing them into interventions, which isn't common practice with other services, which is one of the perks of the mental health support team.
So the main way that we help children and young people is through an approach called cognitive behaviour therapy. So we use low intensity cognitive behaviour therapy, and what this means is quite often it's not our events that we experience in our lives that upsets us, it's our perception of them. So for example, if I'm walking down the corridor and I wave at somebody and they wave back, and I think, oh my God, they hate me, that person doesn't like me anymore, I might feel anxious, I might feel really tense, and I might withdraw and not speak to that person anymore. And then that confirms that thought that they don't like me, and we get stuck in these cycles without realising. So we support children and young people to realise if they've been trapped in one of those cycles, and we help them to break out of them through changing what they think and checking out the evidence for their thoughts, and for what they do to changing their behaviours. Because if we change one of those things, the cycle breaks and we can do things differently and achieve our goals.
It's made such a difference, and I think that the sooner that you can seek support, get that support and help your child move forward, the more that child will be able to settle down, be able to understand themselves and feel validated and supported in their journey forward to becoming a young adult. It's absolutely crucial that you seek support if you feel that you need help, and I have to say that the mental health support team have been absolutely amazing for my son.
It's okay to not know exactly what's wrong. You might just have a sense that things feel a little bit off. You might be experiencing scary thoughts, and it's quite common to have thoughts about not wanting to be alive anymore, or even thinking about hurting yourself. And if you are having these thoughts, these can be really scary, but it's okay. These are symptoms of poor mental health, and we can offer you support to help with these.
Within our role, we work with the whole school community, including parents and carers, young people and staff, to increase awareness on mental health and improve the mental health support on offer in school. As you can see on the slide, we offer this support in a variety of ways. We offer individual and small group interventions which support different mental health concerns. These can be with young people directly, or for younger children, we can also offer this support through a parent, carer or guardian. We also offer a variety of workshops for pupils, parents and staff, and work with the school to consider when they would like these to run throughout the year. We have a menu of workshops which the school can choose from, with topics on managing exam stress, understanding low mood and anxiety, and managing transitions, just to name a few of them. If a school identifies a specific theme which would support mental health in their school, we can tailor our workshops to best suit these needs. We offer mental health ambassador training. This is where we teach students about how they can support their own mental health and the mental health of others. At the end of this training, they are then considered to be the school's mental health ambassadors, and it's up to the school how this role is used. We also offer staff support through consultation and time to reflect. Time to reflect is a space where staff are given time with a practitioner to discuss how to support children with their mental health in school, such as what has a staff member already tried, what has and hasn't worked, and what could they try going forward. The process of consultation will be discussed later on in this presentation. This is a list of the mental health concerns we can support. We offer a range of interventions which can support low mood, worry, social anxiety, general anxiety, phobias, OCD, separation anxiety, emotion regulation, and if a young person is in primary school, we can offer support to parents for behavioural difficulties. As we're an early intervention service, the presentation of the young people we work with would be mild to moderate.
As mentioned in the video earlier, the work we do in the mental health support team is low intensity cognitive behavioural therapy, also known as LICBT. This is an evidence-based talking therapy. This means that there is evidence that LICBT can be helpful for children and young people with mild to moderate mental health difficulties. The first appointment we typically have with children, young people and families is a mental health assessment to find out about the presenting difficulties that a child is having. Following this appointment, we will talk about what support is available and may be most helpful. This may be continuing work with our service or supporting with referrals and access to other services. Where we feel that LICBT will be beneficial, we will start working with a child and/or parents and carers over a duration of 6 to 8 sessions. These usually take place once per week in school. We can also offer this support in a group format where families agree to this and it is felt that this would be beneficial. This is an overview of the referral process within MHST. After noticing signs that a child may be struggling with their mental health, we recommend speaking to a member of school staff. All the schools that work with our service will have a designated mental health lead in school, and you may already know who they are, but you can also talk to a teacher or other member of staff. A member of school staff is then able to attend a consultation meeting with a member of our team. This is an anonymous conversation where no names or identifiable information about children or families is shared. The school staff can use this space to discuss a child's mental health difficulties, and we can also offer signposting and support. We will also advise whether LICBT is likely to be helpful and whether we suggest submitting a referral into our team. The next step would be a referral, which we recommend children and families to write themselves. Schools then send the referral to Children and Family Health Devon. We do also accept self-referrals, and you can find the referral form on the Children and Family Health Devon website. If you do self-refer, we may need to inform the designated mental health lead in school that you have done so due to appointments taking place in school. We also ask you to let us know on the referral form who the child's trusted adult in school is, which can help us to coordinate appointments and support in school. The MHST will review the information on the referral to determine whether this can be accepted for a mental health assessment. We will then make contact at this point to advise of the next steps.
The mental health support team also offers support by signposting to other helpful resources and organisations. On the screen, we have included some information about a selection of those resources available to help support looking after mental health. Children and young people can reach out to a trusted adult within their school if they have any questions or want to talk about accessing support. For anyone who would like to know more about how the mental health support team came to be, then there are some links on the screen. The Green Paper, Transforming Children and Young People's Mental Health Provision, builds on Future in Mind and the ongoing expansion of NHS-funded provision. It sets out our ambition to go further to ensure that children and young people showing early signs of distress are always able to access the right help in the right setting when they need it. Thank you for listening. We hope you now know something about who we are and how we might be able to support your school. We look forward to seeing more of you in September.